Imagine the following scenario. You've gone to see a clinician concerning pain in your right shoulder. After a brief examination, they start ordering tests to check your gallbladder. You're left wondering, what on earth are you talking about? Are you a real healthcare worker? Well, chances are that they are. Probably.
This an out-of-season April Fool's joke.
The motive behind this seemingly random test is due to a phenomenon known as referred pain. This occurs when the pain you feel in one part of your body is actually caused by pain or injury in another part. This might seem quite strange and nonsensical, but the reason behind it is actually quite straightforward. The way your body receives signals to tell you that you are in pain is through nerve cells. These nerve cells extend out from the spinal cord, from the central nervous system to the peripheral nervous system, where they extend to the skin and organs. The skin naturally has higher sensory input, as the body's ability to discern touch is important. This is why a paper cut on the fingertip can cause even a grown man to cry, as your fingertips are densely packed with nerve endings. You may at some point have come across the rather disturbing visage of a homunculus. This creature doesn't just exist as a manifestation of your sleep paralysis demons. It's actually a visual representation to show how different parts of your body are more or less sensitive. As we can see from Bob here, the hands and face, in particular, the fingers, mouth, and tongue are highly sensitive due to the high concentration of nerve endings found here. Another important concept to understand here is that of dermatomes. A dermatome is an area of skin that is mainly supplied by a single spinal nerve. These dermatomes are broken down into groups where the nerve endings of the entire region will converge back to the same spinal nerve. As we can see in this diagram here, the spinal nerve found at the cervical vertebra 5, that's Charlie 5, extends over a significant portion of both arms. Nerve fibers of higher region sensory inputs, such as the skin, and nerve fibers of lower sensory inputs, such as that of the stomach, converge at the same level of the spinal cord. This can result in confusion on where the pain is coming from. As such, the stimulus of lower sensory inputs can be interpreted as coming from higher regions, resulting in a pain sensation that is localized along the related dermatome of the same spinal segment. Perhaps the best known example of this is the pain experienced during cardiac ischemia. Quite often, when a clinician is trying to rule out a myocardial infarction, also known as a heart attack, they might well ask you if you have experienced pain radiating down the left arm. On rare occasions, it can happen in both, if the signal is strong enough to be felt on both sides of the vertebra. As we can see from the following diagram, owing to the way spinal nerves converge, it is far more common for the pain to be localized to the left side of the dermatome, the left arm. As such, this pain is most often felt in the neck, left shoulder, and down the left arm. Where this can get confusing, however, is when you experience pain in a dermatome that seems completely unrelated to the organ in question. As I alluded to at the start, pain in the right shoulder can be a sign of damage to the gallbladder, an organ found in your abdomen. So how can this be? Well, this is because whilst an understanding of dermatomes can help us understand the distribution of nerve cells, your body seldom likes to play by clearly defined rules. If you were paying close attention to my words earlier, you would have clocked on that I said that a dermatome is an area of skin that is mainly supplied by a single spinal nerve, not only by a single spinal nerve. The Phrenic Nerve, for instance, connects to the spinal column at the C3, D4, and C5 nerve roots of your spinal cord. There are two Phrenic nerves, the left and right, each of which extend down to the thoracic diaphragm. These carry out the same function, with the left phrenic nerve carrying signals to the left side of the diaphragm, and the right phrenic nerve carrying signals to the right side of the diaphragm. These work in tandem to stimulate contraction and help to control ventilation. The gallbladder is found inferior to the liver on the right side of the body. When your gallbladder is inflamed and swollen, it irritates the phrenic nerve. This signal becomes confused with the associated dermatomes, the right shoulder area, resulting in pain. So let's have a look at what the body might be trying to tell us when we experience these referred pains. Pain in the chest, particularly in the left-hand side of the chest, that radiates down into the left arm, are possible indicators of heart problems. This could be pericarditis, swelling and irritation of the pericardium, which usually causes a sudden, sharp, stabbing pain that gets worse when you breathe deeply or lie down. Angina is another possibility, which is brought on by reduced blood flow to the heart muscles. These symptoms are very similar to that of a heart attack, a myocardial infarction. In fact, angina is often a warning sign, could be at risk of a heart attack or stroke. As such, it is of vital importance that clinicians triage and take these symptoms very seriously. Given their proximity, pain in the right shoulder can be a sign of problems to either the liver or the gallbladder. Of course, a little bit of deductive reasoning and background is required. If someone was at the gym doing overhead presses with 100 kilograms of weight prior to the pain occurring, it's much more likely that it's damage to the shoulder itself. If this is ruled out, one possible explanation is acute cholecystitis, which is inflammation of the gallbladder. This usually occurs when gallstones block the cystic duct. This results in a sudden, sharp pain in the upper right-hand side of the abdomen, which spreads towards your shoulder. The affected part of the abdomen is very tender, and breathing can make the pain worse. Differentially, the pain could be as a result of hepatitis. Hepatitis is the term used to describe inflammation of the liver. It's usually the result of a viral infection or liver damage caused by drinking alcohol. Some of the most common types of referred pain can be found here. If pain is not localized to the right-hand side of the shoulder, instead found more around the neck region, it may indicate problems with the lungs or diaphragm. The kidneys cover quite a wide area of the body, and pain anywhere in the mid to lower abdomen down to the outer thighs may be indicative of kidney issues. In addition to pain in the right shoulder, pain found in the right dorsal side of the abdomen can also indicate liver and gallbladder issues. Pain in the middle of the thoracic diaphragm or between the shoulder blades can indicate problems with the stomach, and why the intense pain of acid reflux, also known as heartburn, can often be mistaken for a heart attack, as well as in the more typical regions you would associate it. Pain on both of the inner thighs can show that there are urinary or bladder problems. All of this is to say that referred pain is simply one in a toolbox of techniques that clinicians can use to help narrow down a diagnosis. That seemingly insignificant and innocuous pain found on the other side of the body, when combined with other symptoms, can help healthcare professionals to narrow down exactly what's going on under the hood. Now, at the time of making this video, there are a number of theories as to why deferred pain occurs, as well as the mechanisms behind it. There is no clear consensus as of yet, however. When more information comes to light, I would love to delve deeper into this topic. I will leave links in the description to several research articles if you would like to learn more. For now, that is all from me. Thank you very much for watching.